If you've ever had a pulled groin, the medial thigh muscles are the muscles you either strained, stretched, or teared. They're commonly affected in quick starts, like in track and field, or extreme stretching, like in yoga. Their primary function is to adduct the thighs, or bring them close to midline. The primary innervation is through the obturator nerve, whose origin is from the ventral rami of L2 through L4. This nerve courses under and then medial to the iliopsoas, then through the obturator canal, which is an opening in the obturator foramen formed by the obturator membrane. The nerve then splits into the anterior and posterior divisions. The anterior division gives off a cutaneous branch, which provides sensory innervation to the medial thigh. The most anterior muscles in this group are the Adductor Longus and the Pectineus. Deep to these muscles is the Adductor Brevis and the larger Adductor Magnus. Hidden even deeper is the obturator externus, and then the most medial muscle is the Gracilis. The first muscle we'll discuss is the Pectineus, Latin for comb. It's innervated primarily by the femoral nerve. Sometimes an accessory obturator branch innervates the Pectineus as well. It's supplied by the obturator artery, and it originates from the pectineal line of the pubis, particularly the superior pubic ramus, and then inserts into the femoral pectineal line. The function is to adduct, flex, and externally rotate the thigh. In the same plane is the Adductor Longus. It's innervated by the anterior division of the obturator nerve, supplied by the deep femoral artery. It originates from the pubic body inferior to the pubic crest, and it inserts in the middle third of the femoral linea aspera. The function is to adduct the thigh. Next is the Adductor Brevis. It's also innervated by the anterior division of the obturator nerve, supplied by the deep femoral artery. This muscle originates from the pubic body and anterior surface of the inferior pubis, and then inserts into the proximal femoral linea aspera and partially the lesser trochanter. Functions include thigh adduction and minimally thigh flexion. The largest muscle is the Adductor Magnus. It's supplied by the deep femoral artery, but it has two innervations: the posterior division of the obturator and the tibial division of the sciatic. This is because there are both adductor and hamstring portions of the Adductor Magnus. Both muscles serve to adduct the hip, but the adductor portion primarily flexes the hip, whilst the hamstring portion extends the hip. This muscle originates from the inferior pubic ramus and ischial tuberosity and inserts into the adductor tubercle and linea aspera of the femur. Hidden behind all these muscles is the external obturator. It's innervated by the posterior division of the obturator nerve and supplied by the obturator artery. The external obturator originates from the obturator foramen and membrane, and it inserts in the intertrochanteric fossa of the femur. The function is to adduct the thigh, as well as laterally rotate it. Latin for slender, the gracilis is the most superficial muscle on the medial side of the thigh. It's thin, flat, and narrow, and it's innervated by the anterior division of the obturator nerve, supplied by the medial circumflex femoral artery, originates from the inferior pubic ramus and body, and inserts in the pes anserinus, Latin for goosefoot. This refers to the medial aspect of the proximal tibia. The function is to flex, adduct, and medially rotate the thigh. Clinically, this muscle is often used as a flap for microsurgery and reconstructive surgery. It can also serve as a functioning pedicled flap transferred for treatment of anal incontinence. Please subscribe to check out our next videos on the anterior and posterior compartments of the thigh. See you next time!